So we get to SARS-CoV-2. We now have 3 vaccines. 2 are mRNA vaccines, and 1 is a adenovirus vector vaccine. From your perspective, these vaccines were developed rapidly, but safely. And the reason they were developed rapidly is the science was there, and the government put billions of dollars into their development. And because of the pandemic, I can tell you all research in this country stopped. That was not pandemic COVID related last March. And everybody threw their expertise into development of things like vaccines. So these were developed rapidly, but in terms of all the studies that were required, phase 1, phase 2, phase 3 studies, they were all done. In fact, the standards were expanded for phase 3 study from 6 weeks to 8 weeks. And the number of people, minimum number of people you had to recruit for your study was 30,000. So these were very well studied. And then they were vetted. Once the study was done, the company needed to turn it into the FDA. The FDA simultaneously released these, the phase 3 study results for study to the Biologics Committee, which is a voluntary committee of experts, and also to the ACIP, which is a CDC subcommittee for immunizations. And all vaccines go through that committee. So when these were submitted in early December of 2020, the FDA, the Biologics Committee, and the Immunologic Practices Committee all reviewed these. And so you may remember that the FDA approved what they, after 3 weeks, the next day, the biologics approved, the next day, the vaccines. And that happened for all 3 of these drugs. That's the process. Let me just, it talks about breakout sections. Do I have more time?
Yeah.
Excuse me, before you go on, could you just
So all 3 of these vaccines went through that setting. And so people say, well, that's still not a lot of experience for safety. And indeed, pregnant women were not studied, although 20 in the Pfizer study and 12 in the Moderna became pregnant. That's not enough women to make recommendations for women or pregnancy or lactating women. But the urgency of immunization of healthcare workers, you remember we had a winter surge where there were a lot of healthcare workers exposed, healthcare workers getting COVID. So that the recommendations, and by December, what we knew about SARS-CoV-2 is if you're pregnant and you get COVID, your pregnancy becomes a high-risk pregnancy, and the risks to the baby and the mom are significant. They were rare risks, but there were bad outcomes, which is what's happened with influenza and other serious illnesses. So we know that these conditions with SARS-CoV-2 are high risk. So experts, all the expert organizations in the country, infection ones and OBGYN, recommended that healthcare workers where the risk was high for exposure to SARS-CoV-2 receive that. So over time, about 20,000 healthcare workers have now, who are pregnant, have now received the vaccine. And to date, there have been no significant reported problems. So the same thing, you'll hear about deaths on the vaccine. You'll hear about Bell's palsy. You'll hear about Guillain-Barré syndrome, but when they've looked at the frequency of these problems, they're no different than what you'd expect. And indeed, we have experience with these vaccines now. We have 165 million doses in the United States given. We have 65 million people, which is about 20%, have been fully vaccinated. And I can tell you in nursing homes in the country, after December 5th, prevalence of SARS-CoV-2 in nursing homes and assisted living has dropped to 97%. In our county, there has not been a single case since February 17. There were 2 fully vaccinated healthcare workers in the last 3 weeks that have had it, but they were asymptomatic. They were only detected because we screen weekly for SARS-CoV-2 in healthcare workers in nursing homes. So these vaccines look really pretty safe, and deaths are really rare. There recently been 3 deaths reported in the 4th surge in Michigan in nursing homes. Again, that has not been fully vetted, so we don't know if that's really related or not. But up until that time, no deaths have been reported in people who are fully vaccinated. Uh, the who does poorly with SARS-CoV-2? People who are frail. Uh, we know that people with neurodegenerative disorders, like my mother, would are at risk for getting befuddled. We know that within the nursing home population, if the systems are not overwhelmed, the mortality is about 15%. And in those who develop, become hospitalized and require ICU stays, the stays are long, commonly 3 to 4 weeks. And that recovery is prolonged, and some people may never recover. The loss of smell and taste, the fatigue, the headaches, the brain fog are real and fairly common. So again, this is an illness to uh, uh, avoid. Uh, and in terms of intensity of care guidance, prior to the arrival of vaccines, particularly when in the early on in New York, when they were overwhelmed, you had mortalities in the 50% range um, for hospital patients in the ICU. That subsequently has improved down into the 20% range in people in the ICU. But ventilator support's common, prolonged recovery, and then there was caution regarding prolonged ventilator use. Now, because we have so much better outcomes, these conversations are not as crucial. So when you fill out the pulse form, I probably would on that sub-tab under full intensity treatment, would still say, I do not want to be in the ICU on a ventilator longer than a week. But that's in general true. My preference is not to be on a prolonged ventilator in the ICU. Um, so the so uh, the current recommendation for public health, and I support these recommendations, are uh, everybody should be vaccinated in your social group and your caregivers. Is this mandatory? You're starting to see companies mandate this, and some Methodist hospital system with 35,000 employees in Houston is mandating it. So you're going to start to see that. It's controversial, but the vaccine is so effective. And if you're a healthcare worker and you're taking care of frail patients and you have asymptomatic COVID and you're giving it to that person, that's just not a good situation. So I can tell you statewide at this time, um, the opportunity for vaccination of healthcare workers in nursing homes and assisted living has happened almost universally. And there's still about 30% of the healthcare workers statewide who are not convinced. So if you're around a healthcare worker and they're not convinced, I would really encourage them to discuss this with their physician or a trusted advisor because they should be vaccinated. Uh, I am fully vaccinated. Most of you probably are as well. But I minimize my time in public indoor spaces. And I can tell you, double masking is something you should be doing indoors. What that means is wearing a medical mask and then putting a cloth mask over it. The purpose of the cloth mask is it actually gives a better seal. So if you, I think all of you have experienced your glasses fogging up because your air is escaping into your glasses. You really do not want that to happen. So double mask and then social distance. And unfortunately, you can be fully vaccinated and get SARS-CoV-2 and be transmitting. Uh, uh, Probably happens about 1 in 200 times, but the literature is not real clear yet on that. And it also depends on your immune system. I can tell you the influenza vaccine is only 40 to 50, maybe 60% effective in any given season for preventing influenza in nursing home residents. But nursing home residents, their immune system is an older immune system. It just doesn't work as well. It does prevent hospitalization and death in nursing home residents, but it should be no surprise that these vaccines are not going to be as effective in nursing home residents for preventing illness. A lot of what happens with SARS-CoV-2 depends on the prevalence of the disease, which was quite prevalent last December and January, and much less so now. And the less disease prevalent, the less risk of getting it, but also on your own immune system. And so there are CDC guidance about for fully vaccinated. And if you want to know anything about guidance, you just Google CDC guidance for fully vaccinated persons. You can get the details. The outdoor space is really pretty safe because we know this vaccine or this virus is transmitted almost always by the secretory route. The outdoor space with fresh air coming in, with light to deactivate the virus and sun to deactivate the virus and to create a drying or a desiccating effect, the outdoor space is really quite safe. And that's where you should be spending most of your time. So walking the dog is a good thing. This slide right here is mainly for you to kind of think about all of the reasons why people say they aren't getting vaccinated. I covered some of these reasons, but what we're finding with like healthcare workers who say they're not going to get vaccinated is it isn't necessarily an issue of not enough information. It's who's providing the information. Is the internet providing the information? Is a trusted friend providing the information or a family member? Who's providing the information not to get the vaccine? Who do you trust? Because that is the key issue. So I can ask people, and the way typically the experts are saying, you ask this question of somebody who says, I'm not going to get the vaccine, or a town hall meeting where there's a bunch of folks like that. Basically what you say is, can any of you tell me what your friends are saying about this vaccine? Because it's a whole lot less intimidating for somebody to say what somebody else thinks, which is exactly what they think, as a hypothetical, than to tell you what they really think. So if you really want to know what somebody thinks, you basically say just, what are your friends saying about this vaccine? Or what are you reading? What are you hearing? And because that's the way you get actually at the real reasons. And then you can start to address some of these concerns. And again, the book is still being written on SARS-CoV-2. We're going to get more information, and that's why you're seeing evolving guidance on this pandemic.